There's a growing sentiment that doctors intentionally keep us sick to ensure we remain their patients and continue relying on medication. Some claim that doctors are in league with pharmaceutical companies, receiving kickbacks for prescribing medications and treatments. But how much of this is fact, and how much is just a conspiracy theory? Let's dive deep into this controversial topic, look at the claims, and see what the reality is. Setting the stage. It's easy to understand why this theory exists. Over the years, we've seen increasing skepticism toward large corporations and industries, especially those that profit from people's health, like Big Pharma. Healthcare in many parts of the world, particularly in the US, is expensive, with rising drug prices, sometimes unnecessary procedures, and no wonder people question the motives behind certain medical decisions. Exploring the claim. The main accusation here is that doctors, knowingly or unknowingly, are part of a system designed to keep patients in a cycle of dependency. The argument is simple. If patients are continually sick, they keep coming back to the doctor and pharmaceutical companies keep selling medications. But to fully understand this idea, we need to break it down into three components: the role of doctors, the influence of pharmaceutical companies, and the economic structure of healthcare systems. Let's first examine the role doctors play in the healthcare system. Most doctors dedicate years of their lives studying and training to help others. Their goal, at least for the vast majority, is to improve patient outcomes and ensure people live healthier lives. But no system is perfect. Doctors are often under enormous pressure, working long hours, administrative burdens, insurance company demands, and the challenge of keeping up with new medical research. Despite their best intentions, doctors are still human and work within a flawed system. And while it's possible that some may fall into bad practices, the overwhelming majority are motivated by their commitment to healing and improving lives. Are doctors incentivized to prescribe more medications? A significant concern many have is the financial relationship between doctors and pharmaceutical companies. It's true that pharmaceutical companies spend billions on marketing to doctors, including free samples, sponsored seminars, and even paid speaking engagements. There's also the reality that in many countries, especially in the US, doctors can be rewarded for prescribing certain medications through perks, bonuses, or even gifts. But does this mean doctors are deliberately keeping us sick just to prescribe more medications? That's a bit of a stretch. While financial incentives can influence behavior, it's important to remember that most doctors base their decisions on what they believe is best for the patient. Moreover, regulations in many countries are increasingly strict, limiting how pharmaceutical companies can engage with healthcare professionals. The economic structure of healthcare. Another aspect fueling the conspiracy is the way healthcare is structured. In countries like the US, healthcare operates more like a business than a service. Hospitals and clinics need to generate revenue. Pharmaceutical companies are profit-driven, and insurance companies aim to minimize costs. This economic pressure sometimes results in overtreatment, excessive prescriptions, or expensive tests. Yet, we should differentiate between systemic issues and individual doctors' motives. The healthcare system might incentivize certain behaviors, but that doesn't mean doctors are intentionally keeping patients sick. The system often pushes for more treatments and medications, but that's more of a reflection of how healthcare is structured than a deliberate attempt by doctors to harm patients. Why medication is prescribed so often? Another component of this theory is that doctors prescribe medications unnecessarily. While it's true that there has been a significant increase in prescription drug use over the past few decades, it's not simply a case of doctors prescribing without thought. Chronic illnesses. The rise of chronic conditions like diabetes, heart disease, and hypertension require ongoing medication. People are living longer, but many with long-term illnesses need consistent treatment. Demand for quick fixes. Patients often want fast solutions. Instead of addressing lifestyle changes, diet, or exercise, which take time and discipline, many prefer a pill that can immediately help their symptoms. Pharmaceutical advances. Medications today are better and more effective than ever before. New drugs come out frequently, and doctors are encouraged to use them for the latest, best treatments. While these factors contribute to more medications being prescribed, it's not as straightforward as doctors wanting to keep patients sick. In many cases, medications genuinely improve and extend lives. The reality of Big Pharma's influence. The pharmaceutical industry undeniably has significant influence in the healthcare world, from lobbying governments to influencing drug prices. There's no question that Big Pharma plays a massive role in how healthcare functions. In some cases, they have been found guilty of unethical practices, like misleading marketing, hiding negative trial results, or pushing drugs for unapproved uses. The opioid crisis in the US is a prime example of how pharmaceutical companies' aggressive marketing and misinformation led to widespread addiction and tragedy. In this case, the industry's greed did harm countless lives. But it's essential to separate the practices of large pharmaceutical corporations from individual doctors. While Big Pharma's influence is troubling, most doctors are not actively participating in these harmful practices. Doctors as patients' advocates. On the flip side, doctors can also act as advocates against the excesses of the pharmaceutical industry. Many doctors fight for their patients, pushing back against unnecessary treatments, and prioritize preventative care over simply prescribing medications. Doctors are often the first line of defense in identifying harmful practices from pharmaceutical companies and educating their patients about the best treatment options. Are there alternatives to traditional medicine? Another angle to this debate is whether alternatives to traditional medicine are being ignored or suppressed. Some argue that natural remedies, lifestyle changes, and holistic medicine offer better long-term health solutions than prescription drugs. In many cases, these alternatives can be effective. Healthy diets, exercise, and mental wellness practices are all essential components of overall well-being. However, not every condition can be managed this way. Many diseases and chronic conditions require medical intervention. The key is finding a balance, working with a healthcare provider to explore all options rather than just relying on one approach. What can be done to improve the system? The frustration with healthcare systems, doctors, and pharmaceutical companies is real, and improvements are needed. Several solutions could help reduce the dependence on medications and foster a healthier system. Focus on preventative care. Encouraging lifestyle changes, healthier diets, exercise, and mental health support can prevent many chronic conditions from developing in the first place. Reduce the influence of Big Pharma. Stricter regulations on how pharmaceutical companies interact with healthcare providers would limit their ability to push medications unnecessarily. Encourage patient education. Patients need to be active participants in their own healthcare. Understanding treatment options, questioning decisions, and seeking second opinions can empower people to make better choices. Promote holistic approaches. Integrating holistic and alternative therapies with traditional medicine may reduce the over-reliance on prescription drugs. The idea that doctors are keeping patients sick for profit oversimplifies a much more complex issue. While the healthcare system, particularly in the US, has its flaws, and while pharmaceutical companies undoubtedly wield significant power, most doctors are committed to their patients' well-being. The real problem lies in the economic and systemic structure of healthcare, not in the individual motivations of the doctors themselves. Rather than viewing the system as an intentional conspiracy to keep you ill, we should push for systemic changes that prioritize preventative care, reduce the influence of profit-driven pharmaceutical companies, and ensure doctors have the resources and freedom to provide the best care possible. In the end, improving healthcare requires a collective effort from patients, doctors, and policymakers alike. While it's important to remain critical and vigilant about the healthcare system, it's equally essential to approach these issues with a clear understanding of the complexities involved. If you found this video helpful or thought-provoking, don't forget to hit that like button. Let us know your thoughts in the comments. Do you think the healthcare system is more about profits than patients? We'd love to hear your perspective. And if you're interested in more deep dives into controversial topics and health-related issues, make sure to subscribe and hit that notification bell so you never miss an upload. Thanks for watching, and we'll see you in the next video.